An L loop or a boot loop or a Snoopy loop, most people call them different things. We use that in all of our extraction cases, and we retract canines with Nitai springs. The canines come back with Nitai springs, and the 4 anteriors are retracted with these L loops. These L loops, again, if you think of what is going to happen, we use compensating curve in the upper, reverse curve in the lower, so that we don't get dumping into the extraction space. The speed of closure is superb. We typically close spaces with uprighting of roots in 4 to 5 months, total closing and total uprighting in 4 to 5 months. Some thinking has to go in it, but that is the advantage, I think, of using the L loops. Also, in the final stage, my 3rd stage of treatment in the upper, we use a larger diameter wire, a 1925, for example, beta titanium wire with L loops, which gives me the ability to torque, to step up, to step down, to get anterior guidance without ever taking the wire out. It's just a very, very useful wire, and I have used some form of an L loop for many, many years. The reason I use L rather than a T loop or an asymmetrical T or a keyhole is that in my experience, over 20% of the time, when you have a distal component to a loop, it interferes in the canine eminence area. It interferes with the gingival tissue, and you are trying to torque, untorque, bend, etc. to avoid this tissue impingement. And with the beta titanium wires now, you really don't need to have lots of extra loop in order to get the proper activation and to have light forces.